recording and start. How do we? It's about to on the table, but I don't know.
What'd you say?
Let's move it to the right.
Yeah, just slide it over. I don't see, oh, there it is.
Oh, there it is.
Okay, so
Oh,
now you see that it's over there. It's all three monitors on one desktop.
So now what?
So you can put that out. if you want. Stop recording.
Yeah, I think.
Yeah, your speakers are not working properly.
Oh,
Your voice can still be recorded, but the voice of the other participants
That's
not.
fine. That just means that when you come back to the board, you want to make sure you want.
oh, okay.
Yes.
Okay.
Yeah, you just want to make sure that this is not muted.
Is-
Okay.
Good afternoon, everyone. I am Mary Sewell, the Associate Director of Alumni Relations and Health Policy and Management. We will start in a few minutes. We will begin the seminar. Thank you.
All right, well, welcome everyone, and thank you, Dr. Novello. Delighted to have you here. I am Beth Resnick. I'm the Director of the MSP Program and Health Policy. And I'm just going to kick us off, and then we will have our terrific student moderators leading our session. But I want to first thank Mary Sewell and also Brendan Slaughter, the Director of the PhD program, for coordinating with us for this special session. I was just telling Mary this morning that there was a session here many years ago with Colin Powell, who was here. And I brought my oldest son, who was maybe around 8 or 9 at the time, with me. I don't know if it was based on just that seminar, but my son is now in the Air Force and works at the Pentagon. So the impact of these sessions and these leaders here are really incredible. So again, I want to thank Dr. Novella and Mary for making this happen. And I think our chair, Dr. Keisha Pollock Porter too. I just want to pass off to these amazing students who are going to be the lead and have worked with Mary and Dr. Novella. They're very excited to have you here. We have Gracia Vargas Melendez, who is a doctoral student, and Nicole Espinelli, who is one of my MSPH master students. I'll take pride in both of you. And they're going to introduce Dr. Novella and lead us in a great discussion. So please get your questions ready. And thanks to these amazing women who are going to take us on a great day. Thank you.
Good morning, everyone. My name is Nicole Espinelli. I am an MSPH candidate in Health Policy and Management here in the department. Thank you so much for attending this session today.
Buenas tardes, todo el mundo. My name is Grecia. I'm a PhD candidate in Health Policy and Management here at the department, and Nicole and I will be moderating today's talk.
We are happy to introduce Dr. Antonia Novello, a dedicated public health advocate. Dr. Novello made history as the first female and first Hispanic U.S. Surgeon General in 1990. During her tenure as Surgeon General, she focused on the health of women, children, and minorities. She launched initiatives to combat underage drinking and smoking. Additionally, she recognizes the need to focus on women with AIDS and to prevent the neonatal transmission of HIV. Dr. Novello has earned numerous awards during her storied career as physician and public health official, including the Public Health Service Commendation Medal in 1980 and many more thereafter. Dr. Novello obtained her MPH at Johns Hopkins in 1982, followed by her Dr. PH in 2000. Again, thank you so much, Dr. Novello, for coming to talk to us about your public health career. We are excited to learn about your journey and how you navigated the public health field. So to start off, we have our first question. In your book, Duty Calls: Lessons Learned from an Unexpected Life of Service, you share your story of your inspiring journey from Puerto Rico to the White House as Surgeon General. Can you share some key lessons learned and moments along your journey that you think will be most helpful to public health policy graduate students coming into the profession today?
Well, the most important thing I have to tell you is if you hear an alarm, is that I live in a condo, and today at this time they have decided to check the alarm. So if you hear leave the building, is not don't listen to it because I'm
Good
not
to know.
planning. But first and foremost, thank you for the invitation. I have no idea why have you put this seminar together, but I do believe that sometimes, like my book says, lessons learned from a life of unexpected service will come to each one of you. It's just a moment to wait for, and it will happen. I think the best thing that I ever did was to come to Hopkins, and it was basically because it was so close to the National Institutes of Health that I thought, why not? And so the most important thing that I learned is basically that opportunities are not going to fall in your lap. You have to work for them. And some of the ones that are crucial and that will help you more than anyone is this feeling that Hopkins now is #1 in the nation regarding public health, and that I have already shoved in the face of all the ones that I have seen in the recent past. And that also helps. But one of the things that helped me tremendously is realize that public health is much more than epidemiology and much more than biostatistics. And so when you have program policy and you have management, it sounds so big that you always feel you cannot get to it. But the future of public health basically is going to depend on policy changes in the future, specifically as we're dealing with so many changes in the world, and we have to have leaders that really can go into the policy arena and try, if not to solve, at least to educate people regarding some of these topics. And so I really value this opportunity to be able to talk about some of the things I learned during my past. But the most important thing is reminding people things will not drop in your lap. And one of the most important things that I did is that I did not do epi and I did not do biostats. And I fell in love with government, and I fell in love with how the government intervenes in my life. And then I went and learned more about it.
Thank you.
So throughout your career, you've had many firsts, first female, first Hispanic, and first to take public health and healthcare in an important direction as U.S. Surgeon General. Can you share some of the joys and challenges that being the first has brought, and offer any lessons learned from your experience to our students forging a new path in a professional journey?
Well, you never know that what you learn, you can put it to use. And one of the times that I put to use everything I knew about public health is when I was the health commissioner of the state of New York during September 11. And then I can tell you that as a leader, you can be afraid. As a leader, you want to start running away from what you're looking at. But as a leader, you're expected to take charge of what is happening at the moment. And that happened in particular to me. And so I wanted to leave the place because there was so much carnage and there was so much crying and so much people in turmoil that I just didn't know where to start. But it's the same thing that happened when I was Surgeon General. You have to have an agenda in your life. Things don't drop in your lap. You must know where you're going to go. Otherwise, you're already there. So you have to plan your life, and you have to have an agenda, and you have to make sure that you go at the place that you want to be. And for that, you have to study to get there. And for that, I think you're going to need great mentoring and terrific opportunities that do not come at the teaching level. It comes from life teachings. And this is why, for me, it was very important to immediately know that you have to have a person that believes in you and gives you the mandate when you're totally in the dark. And that happened during September 11, because the governor called immediately, because if you remember, once the tower fell, there was no communications in the whole state of New York. They fell down with the building. So you learn to use walkie-talkies without even knowing what they were. And more than anything, immediately start the pursuit of planning, prioritizing, and going at it. And for that reason, that's why I say you must have a plan of what could happen, because in this day and age, it could absolutely happen to any one of you when you finish your career. So plan, mentorship, and ready to learn what is the next stage of what you have to do. But more than anything, don't be afraid. Don't be afraid. Some of us will be afraid and will be immobilized. But remember as well, don't invent policy out of fear. Don't be looking for those 15 minutes of fame. Steal it from your mentor, and then long run, you will be able to never recover from that one, because you always have one boss only, and that boss is the one that put you in that situation. So respect seniority, learn from it, and mentoring needs to respect the person that is helping you in your life.
Thank you so much. If you could hit the rewind button back to when you were a student here at Hopkins, what do you wish someone had told you then? And what might you have done differently in your post-MPH and Dr. PH trajectory?
Well, remember, you have always a subspecialty. As a master's, I had health services administration. And as a doctorate, I have my policy. Sometimes you study one thing and life puts you in another way. And that's the important thing of going to a Hopkins, in where you can always have help from the things that you never dreamed that you will study and might never utilize. You might end up doing something totally different of what you studied. For that reason, I think that we all become 1 mile of knowledge and 1 centimeter of deep interest. And for that, don't be afraid that you might be practicing things that you never dreamed you will be at. So be prepared for whatever comes your way by always keeping abreast. I believe in public health. The biggest thing I learned is, which not many people tell you, is that you will be working in a field in where many people will live because of your actions, but they will never know your name. And for those that forever want gratification, this might not be the place for you, because you will do things to save the world, and many people would not ever know that you were behind them. So I like the anonymity that comes with public health, and the ability to impact so many lives and still live with the feeling that you were there during that time. And so it's one of those wonderful professions in where you know a little bit of everything, but don't get confused with the degree by which you finish your doctorate or your master's. Just always be ready with that knowledge to be impacting areas in where your life will bring you, and you will use them to be able to move you ahead. But don't block your career with just a degree. Block your career with knowledge. And that's why I feel information is so crucial, specifically today, where we have the presence of artificial intelligence, in where just with one little chat, you have all the information that you think you have. But remember, artificial intelligence is only as good as the information that is in it. And for that reason, if you're going to use it, make sure that you check your bibliography, because it will always be incomplete. And more than anything, be able to check the data that is in there, because it gives you a hands on the data, but not the completeness of today, unless somebody is forever putting data in that particular subject. So my worry about artificial intelligence, as people who will always be touching other people's life, is that we must make sure that we never forget the names and not confuse the statistics of the people that we're treating with humans.
Thank you. As the world of public health and healthcare is changing, becoming increasingly polarized, can you share advice for health policy graduate students to best prepare themselves to have a maximum impact?
Don't focus only in one thing that you know, and you have to learn the field of what is happening in the world if you're going to participate and be a credible, trusted ally. And for that reason, you cannot look, for example, at the healthcare system of today, trying to make it just one payer, if you really do not know that the system is one thing, but the people who make it are another one. You must know what is happening to the people that you will be impacting. And in that sense, remember, we have a lot of issues that are pertaining to the medical system and to the medical group who works in it, in particular since the pandemic. And in that sense, know the facts. 29% of all the people who work in health are depressed. One doctor gets suicide every single day. There is where you feel that the leader in the system is not paying attention to you, and therefore you always get this feeling of imposter syndrome, and you get all this feeling of people not paying attention to your worth, and your worth is diminished because no one is looking. Most of the problems that happen in systems of care today happen to be secondary to the leader that is up there making the money but not taking care of his people. So don't go out there talking about solving the issue unless you know the issue from the place to the people that work in it, and be knowledgeable so that your ideas will be trusted with what you bring to the place in where you're being asked opinions. But I am so concerned about what is happening to all of us regarding the healthcare system, and everybody trying to change it. But don't change it just by what you read. Sometimes you have to be in it to be able to really explain it with trusting words that you will be trusted by the ones who are listening. So the changes that are coming are multiple, and with artificial intelligence right there at the level of everybody, just be sensitive that you will have the data at your fingertips, but make sure that you look at it closely, because that data comes from you, even though it has been taken seriously by the artificial intelligence with your finger in the chat. So be sensitive from now on. With your degree, you're a trusted advisor. With your degree, you have the trusted information that is needed. And with your degree, don't invent policy that you do not know just because you have that camera under your face for the next 15 minutes. It can help you to build your life, but it can also, in those 15 seconds, destroy your future.
Thank you so much for all those advice. Similarly, how can students coming into the profession prepare themselves to have maximum policy impact, especially in a time when public health is getting increased politicized?
Well, one of the issues at hand is, remember, I could not believe that the CDC suggested one time that the pandemic will disappear exactly on the day of the anniversary of the United States independence. I just couldn't believe it. Neither I could believe that they took away the mask when we still had so many cases of COVID. I believe that that moment could have been a big politicizing of a disease, trying to be able to help someone beyond the people who were suffering COVID and long-term COVID, as we can see today. So I would say, know your data. Know what is it that you need to go involved into. Stay true to your center. There will be many episodes in where many people will try to send you in the place that they want to, sometimes for their own benefits and not for your own. Know your field, know your data. Don't get confused with somebody who wants to use you or your data to proceed to move ahead. Just stay in your center. Public health will make that very easy for you, but for that, you must continuously keep informed of data, what is happening in the country, who is your mentor, and what is the need for you to get involved to save or do something that will be unique. You were born an original. Whatever you do, don't die a copy.
Thank you. Is there anything else you'd like to share or any gems of wisdom before we go to the general Q&A from the audience, Dr.
No,
Novello?
I think that your question has been quite poignant, and maybe some of my answers are not as complete as you have expected. However, I believe that the questions and answers that will follow now might be much more apropos for learning a little bit more from things that might not come out of the questions asked at the beginning, but that will come out of reminiscing as we look into the questions for the future.
Does anybody have any questions in the chat or in the audience? Oh, Marco?
Yeah, we'll repeat the question.
One of the questions that I have, could you talk a little bit about your life experiences and what the challenges or growing up led you to where you are now? Specifically because you are responding to people and students who come from racial minorities left out from spaces due to history and its position. It's really inspiring. So can you talk a little bit about your life experiences and how it's challenges and societal norms?
Well, that's a very good question, and it's very hard to answer it complete. But if I don't want to tell you what you have to do, but you have to get out of here and buy my book, because I think it really teaches you lessons learned from a life of unexpected service. But more than anything, all of us have a history to tell, and all of our experiences will be manifested into your future life. But more importantly, I never think of me as a minority. We are millions and millions of people in the 2025. 1 of every 5 Americans will have to know Spanish to understand the majority. And on top of that, when you add the African Americans, the Latinos, the Native Americans, and all of those together, we really are getting close to the 50%. So remember that this business of feeling that as a minority I move or as a minority I get diminished, it has never touched me. The only time that I felt patronized was when I went for an interview to be the pediatric nephrologist at Bethesda Naval Hospital. Having married a flight surgeon, I thought I needed to give something back to the country. So I went to the Navy hospital to join them. And for my amazement and amusement and indignity, the captain that interviewed me proceeded to put his feet on the desk and started reading the Washington Post. When I was flabbergasted that I didn't know what to do with myself, he moved the newspaper and told me, "Did you hear? We are looking for a few good men." I was incensed. No one had treated me with such disrespect. But if you read my book, you will see at the end that in acknowledgements, I thank that jerk. Because if it would have not been such a jerk, I would have stayed there and taken it. But I instead crossed the street, went to the National Institutes of Health, and that same day I joined the Public Health Service, and the rest has been history. So I acknowledge his stupidity in helping me get out of mediocrity. And rather than being a 3-year person in the Navy, I became a career officer in the United States public health system. And look what happened to me. So don't be undermined by fools that with envy of your position or lack of who you are will stand there and try to dominate your future. Realize those things in your life more than anything else, because you will find them along the way. There's no doubt about it. And for women, it has been shown that we can withstand depression, we can withstand rejection, we can withstand everything. But as you're doing that to us, in our mind, what we're saying is, I'm going to get you. And most of the time, what we do is we plan for the future. And eventually, I always say, one thing that I believe blindly, as I have lived many more years than all of you, is karma never forgets your address. You did it to me, somehow I'm going to be there when somebody does it to you. But don't wait all your life waiting for karma. It will happen sometimes without you knowing that it's there. But remember, many people will block your ascension. And as I have learned from many books that I have read, the one who double crosses you is always the one closest to you. And as the leader gains more titles of power, the envy that some people feel for him or her intensifies. So those are things that you will learn after you buy the book. And so there's so many more lessons in there that will be useful in your career, as I saw that. But remember too, I was born with a congenital issue that became a genetic finding, and that never put me behind. On the contrary, no one knows now until they read my book all the issues that happened in my first 21 years that prompted me to be a doctor, that prompted me to be a nephrologist, that prompted me to take care of children. So at this moment, life in your past will turn the way that you are, and there are certain things that you cannot change. But absolutely, you can use some of those experiences for not suffering them again, for saving someone of not going through them, and from speaking from truth, not opinions, of what needs to be done regarding your life plan.
Thank you so much for that powerful answer. Does anyone else have any questions? Yes?
So you've had the serve in high profile roles. What does it mean to think like a public health leader with a public platform versus this anonymous public health practitioner that you referred to earlier?
Well, at this stage of the game, as a public health leader, you have to know what you're talking about. That's extremely important. Like I say, don't have that microphone under your chin and invent policy out of fear. You'll be a trusted ally, and you will be contacted to solve issues of the land. Take that seriously, because I truly believe that when you open mouth and insert foot, you close the loop for somebody else that is going to follow in your footsteps. And people have this ability to forgive you very little for those mishaps and use them sometimes to be able to get you out of the run. So a public leader has to know the knowledge, no opinions, facts, back them up by facts. Second, be consistent in what you're speaking, repeat it more than once. And in emergencies, absolutely only one leader has the voice. It's not what you heard, it's the reality of what happened. And for that reason, we tend to get so lost when we are the center of attention for something that we just saw or read about it. And sometimes we blabber, and when you blabber without knowing, you're giving opinions, and eventually it will follow you for your demise.
Is there any questions in the Zoom?
I have a follow-up question, Dr. Novello. During your time as U.S. Surgeon General, you mentioned that as the first woman and Hispanic, too many people placed too many hopes on your shoulders. We know that oftentimes the further you go into higher education, the lonelier it can become as an underrepresented minority. How do you navigate advocating for your community and at the same time not be deemed the Latino spokesperson?
Well, I was clear from the first day that I was the first Hispanic Surgeon General, but I was the Surgeon General of all Americans. At the beginning, it was not taken very nicely, but with time and acts, they realized that I had to be everybody's Surgeon General. And in my case, it was a little bit more difficult because I followed Dr. Koop. I was not just following anybody else. And remember, the Surgeon General of the United States was never a political appointee. It was a career in the uniformed services, not an appointee. However, by pure serendipity, the Surgeon General of the Public Health retired on the same time that President Kennedy ascended to the throne. And if that is the case, it was taken that both of them went together, President and Surgeon General. And that's why since the 60s, we have had the Surgeon Generals politically appointed by the party at hand, but it was never the way that it was supposed to happen. So my biggest fear, being the first Latino, was establishing from the beginning, I cannot be yours alone, but then you do something for your community. And remember, at the time of the 1960s, where some of you were not even born, the CDC used to say that Hispanics were other, even though the largest number of HIV were in our community. It put it in my head that we needed a Hispanic agenda that set us apart from everyone else. And so what I did, I divided the United States in 5 different areas. And in each one, I looked for the expert and the leader in that community. And I gave them 5 things that as in unison, they had to solve or at least approach. And then at the end, we put them all in one particular document that is called the Hispanic Agenda. And you will not believe how long it took me to convince them of the title, because they wanted Hispanic, they wanted Latinos. So I just said Hispanic, Latino / this is the agenda. And when you have the power to call the shots, that was the way it was. What is now a little bit sad is that still is the agenda for the Hispanics, but it has never changed anything, except that the CDC now calls an ethnic group. And sadly, in the 2000 census, 39 million Latinos changed from ethnic groups to white, trying to perhaps gain a little bit more than just becoming ethnicity and underrepresented.
We have a question in the chat. What is the biggest healthcare problem facing America today?
There are so many, but you know, one thing that I really worry tremendously is I went to a conference in where the title was equality and all the things today. It seems to me that when we are young, we make so many proclamations of things that we cannot solve, of things that sound big and of which most of us only have 1 inch of knowledge. So I really believe that one of the biggest problems I see today is this health disadvantages among most of us, and also the inability to know that we cannot be totally equal, because the definition in itself needs some work. And so it's equity versus equality. And we really don't know that for equity to be real, which is the provision of issues in your lifetime at the level where you are to make it better for your life, rather than equal for us. You have to understand that you have to know education, you have to know wealth, you have to know employment, you have to know crime, you have to know the system of jail, you have to know where they live, you have to know what they eat. And when you look into that, then equity and equality are totally different. And for that reason, I think that equity for all, the ones specifically the minorities, seems to be one of the things that we have to address in this particular time of our lives, knowing that in the African American community and in the Hispanic community, and sadly, even worse, in the Native American community, there are so many gaps that we cannot address unless we work tremendously at it as a group. And today in the maternal mortality, and today in the infant mortality, specifically of the African American communities, there was something very interesting, because a poll was done in the African Americans, and the older ones suggested that 60% of them were pleased with at least one doctor is seeing us. Well, the African American young person between the 18th to the 40s said, I am pregnant, I am dying. My babies are dying. I want a Black OBGYN taking care of me. They demanded it. How they demanded it? With data, with facts, not with just opinions. So when you look into African American, that there's only 5% physicians coming out every year. Hispanics, only 6% physicians, 19% Asian Pacific Islanders, and only 0.3% in the Native Americans. We have to do so much more for training because we are lacking the people who understand my culture. More has to be known that my language, that I can Googleize, but I cannot Googleize my culture and help the patient know exactly what he or she needs from me. And sometimes with so much machinery and so much information coming out of my computer, I am forgetting to touch. I am forgetting to know your name. I am forgetting even your presence because the electronic medical records is always in my face, but at my back is turned to my patient. Things like that have to change if we really want to bond with my patient, because Osler used to say, listen to your patient. He or she will give you the diagnosis. And sometimes today, with the rush of making money and keeping the companies abreast, specifically the ones of insurance and the hospital conglomerations that are happening, we are forgetting that the patient is the center of our life.
Thank you. Earlier you mentioned define rejection and how your interviewer mentioned we're looking for a few good men. What would you say your guidance on how to balance both pushing opportunities for yourself while at the same time not being in spaces where you're not wanted or respected?
Well, I always says when you're in a job that does not respect you, lateralize. Get out of there. Why are we breaking ceilings of which we have not been taught how to break them? I say, if you don't know how to break them, then lateralize. I believe tremendously in lateralizing when I find a glass ceiling that is not helping me. And how do I mean lateralize? I get out of the eyes of the person that is not doing my best, but I do not lateralize to die. I lateralize to build, because in the absence of being observed by my enemy, I will build and I will build and I will build. And believe me, I've done it twice in my life. And the day will come in where you're going to find that person neck on neck with you because you have not become invisible. And depends on how you feel that day, whether you greet them or whether you ignore them. And for that reason, I think it's important. Don't fight the system that does not want you. Don't go in a job of which you are not qualified. Never get involved in putting a paper, your name that you never participated in the research. Somebody else will find it out and it will be very negative in your curriculum vitae. But whatever you do, lateralize. Don't fight the system. And it has been shown that people does not tell us, if you work for a company that does not want you, leave them. There's always someone out there that is looking for you, but do not go into something of which you are not qualified, because you're only going to hurt yourself. And more than anything, don't go into places in where you get more money. Go into places in where you're happy, specifically for what you're doing. Remember, still the United States do not realize that 40% of the households in America are controlled only by a woman. And if that is the case, I think that the man has still the advantage of making more than 70 cents a dollar for work done equal to women, 40,000 between 53,000 men for the same job done. And on top of that, women still have jobs when they come home and after they have work, of which it has been found that maybe they need to gain $85,000 after they come home from a full-time job. And the person that stays home gets $185,000 for doing 2.5 jobs with 18 duties. So you have to know the data to be able to advocate for your own. So if you know the data, the most important thing that I have learned with time is your first salary negotiation will establish your lifetime salary forever. So remember, if they feel that they give you an offer and you take it without bargaining, they got you. Your first salary will determine your life earnings, remembering that in medicine and in the scientific field where we are, men's salaries and women's salaries are totally different. And that means that at the end of 40 years of career, the women will be behind $2 million worth of money that they should have earned, but they didn't. And on top of that, remember as well, when you retire at the age of 65, you will be earning $354 less than a man for doing Social Security. If that doesn't impress you, remember that 3 out of 10 women will use that check for their life after the age of 65. And on top of that, women are known to lose 11.5 years in their career taking care of family members when they get sick. And every time you have a baby at work, you have a 7% penalty. So the woman has the penalty of maternity, while the man has the accolades of being the breadwinner.
Thank you so much for that answer. Do we have any other questions from the audience? From the chat? If not, that's okay. I have a question.
We have a lot of
Yeah,
questions.
so I'm curious, what strategies did you employ to garner support for your public health policies among policymakers, stakeholders, and the general public?
Credibility.
Mm.
Credibility. Remember, when you're in a situation like you will become soon,
Mhm.
what you say, half of the people come to listen and half of the people come to see if you're telling the truth. And in the presence of Google, when I tell you it's 20%, it's 20% because I sleep with data and I spit out data. But half of the people want you to succeed and half of the people are watching how can they get you for your failure. So you must be true to the data. Don't invent policy out of fear. So credibility in your job and your facts are going to decide if you're going to be followed as a leader or if you're just going to be amusing to listen and then never again even come close to you.
Thank you. Similarly, a question about writing. So under your work with Senator Hatch, you mentioned the importance of concise writing and how if write-up went beyond a half page, it would likely not be read. What are your recommendations, or what recommendations do you have for us as young scholars in being able to strengthen our writing? Or
Well, one of the things that this is for me was important. My master's degree, like I said, was in health services administration. However, that class about government and public health drove me crazy. And I wanted to make sure that if I heard the government interferes in my life, I wanted to go to government and learn how can I either know about it or how can I join it. And that's why I truly believe that what saved me for future assignments was the time that I decided I wanted to work with someone in Congress for which I would leave my ego at the door, but I would learn everything that I needed to learn from government. And that's why I would suggest get your congressman or your senator and offer your help at least for a month of your life with no salary, just as a learning experience. Leave your ego at the door. We were 4 people that did that in the times that we all did it, which was in 1989. And so then choose the person that you want to work for. Don't go to a stupid committee just to have somebody say that you have something that you did in Congress. Look for the committee of your plan for your life journey. If it's health, it's health. If it's political, it's political. If it's the issues of agriculture, the issues of immigration, you choose the committee that you want to participate. Mine was health, and we were 4. Why is it important? Because you learn how government works. And the first thing that I learned is they only read half page. What is it that you want them to know? How much do you think it will save the government? How much exposure they will have with what you recommend? And then make sure that you know exactly when to introduce it. I sent so many of those and they never came, and they always came back. And during my tenure, we worked very closely into the labels for cigarette and fought like mad to get the one about pregnant women in there. And also the Organ Procurement and Transplantation Act, because there were people selling organs for $9,000 and there were places in the United States that were doing them ahead of the people in the list. So what you do, it has an impact in somebody's life. But more than anything, that time that I did in Congress and the 4 of us that were there at the time, one became the Assistant Secretary for Legislation for HHS. The second one became David Kessler, the FDA Director. The third one was David Sunwell. He became the HRSA Director, and I became the Surgeon General. In an office when everybody walks in to do politics and policy, you're in the eyes of that senator or that congressman when the time comes to recommend. So Sacrifice yourself for a little bit and make it like a learning experience of an outside class. And trust me, it ends up working on your advantage.
Thank you.
Can you share any examples of partnerships or collaborations you formed with local organizations or institutions to deliver healthcare services to those in need?
Well, one of the things that is extremely important is there's always somebody that is going to come asking you for help. And in those moments, it's not how you feel, it's the necessity of the people, and it will catch you at the heart and at your brain, and you will do it. In my case, when the Hurricane Maria came to Puerto Rico, I wanted to get there so fast and so bad, and there was no airport. So I was able to get there in one of those airplanes that over the ocean checks for drug and transporting drugs. And I went to Puerto Rico with that, with 2,000 pounds of instrumentation, because they had nothing, no electricity, nothing had been lost, with the winds of 150 miles an hour and the floodings of about 12 feet. So I went to a little town, and this guy came to me and says, I have 8 counties around me begging for help, and I don't know how to help them, but I want to. There's that empty piece of equipment there, and there's that empty building there that is rented for $1 for 30 years. How can you help me make it real? So the first thing that I did, I said, we have a problem. And then I went to the 8 communities with him, and I realized that he knew the name of everyone that lived there. He was the leader of the town, and he was only a gasoline dealer. So you pay respect to the one who knows his people. So at the same time, I was really very involved in the moment I arrived with the National Guard. And I made sure that, I'm sorry for them, that the National Guard's vacation for December were canceled so that they can tend to those people in those 8 communities. What they did grudgingly became the salvation of that group, and then the dedication of that group to tend to them for at least a year. I make sure that the unit of the National Guard that tended to them, the building and the rooms in the building carry the number of the unit that saved their lives, so they can never be forgotten. But with time, we got then an ambulance, we got then an emergency room done, we got then dentistry provided for the people, we got then services for you, for women. Now it becomes a clinic in where people from universities of the United States come to learn how do you do community service clinics in the really smack in the middle of Puerto Rico, where there's people and trees. So one little thing helps you tremendously to save a complete group. And the same thing happened when I was a student of public health at the University of Puerto Rico as an undergrad. I hated public health. I hated it for the simple reason that all they talked about was latrines, and all they talked was about stupidity that never touched me. But there was a moment in where they decided that every student of public health inherited a family, and you became the doctor, even though in 3rd year of medical school, you didn't even know that when they call you doctor, it was a joke. You were in charge of them, their medical life, everything that was offered from Medicare, Medicaid, aid for dependent children, you name it. You had to provide them what government offered. And then your grade depending on how much you accomplish. At that moment, I loved public health, but it was because of hands-on service and hands of people. Obviously, I got an A because they were living separated, and I made sure that they got married. But to save somebody's life with your knowledge, that there's nothing in the world that can really give you more satisfaction. So like I said, opportunities will drop in your lap. Do the best you can by knowing the subject, but the heart at that moment will tell you exactly what you need to do.
Thank you so much for that answer. We got a comment in the chat from Karen. She said, your work fighting with the tobacco giant is legendary. Your quote is fantastic. In years past, RJ Reynolds would have us walk a mile for Camel. Today, it's time we invite old Joe Camel himself to take a hike.
Yes. But you know, one thing that happened that really shows that the Office of the Surgeon General can be politicized happened on that day. I was at the American Medical Association walking down Michigan Avenue with the Surgeon General of the Navy, the Army, and the Air Force. And we were going to go against old Joe, kind of saying, old Joe, take a hike. And then as we are walking out, the White House calls and says, you cannot mention old Joe. And I said, what? I'm about to start walking. They say, you cannot mention old Joe. obviously there must be, I assume a lobby is there trying to say what was happening. So I said stupidly, but somewhat intelligently, I said, if I cannot mention his name, can I point? They thought perhaps I was crazy or wacko, and they say, sure. They didn't know that I had a big plaque with Old Joe right next to me, and I walked down Michigan Avenue going like this, pointing at his face. And so at this moment, I got my message out there, and they never said that I uttered a word against Old Joe. So at the end, you remember we took him out of commission, and I love that. So be consistent, have data to prove it, and even when you're called from the White House, if you feel you're doing something right, look for an alternative, but don't get out of your message.
Do we have any other questions?
Can you discuss any specific strategies or initiatives you use to promote health equity and reduce disparities among children, women, additionally in the Latino community?
Well, remember, equity is not only for the Latinos, equity is for all, and specifically all the minorities. But at this moment, one of the important things is always try to find what is going on. And one of the things that really worries me is this redlining regarding the places where the African Americans live. And when I look into that, it breaks my heart because only 17% of African Americans have a neighbor that is African American like them. And during the pandemic, the foreclosures and the expulsions of places where they rented were in the minority women community. And so when you look into that, poverty might not be just getting out of the place, but absolutely, it makes it a reality that was very painful for the women during the pandemic. So one of the things that is also extremely important at that time is these microaggressions, moments in our lives that we might not even be aware are painful. And it has been shown by researchers at the University of Michigan that if you are forever listening as a child, he's ugly, he's black, he's poor, he has no shoes, get away from here, it undermines absolutely their immune systems. And when you look into that, then you realize that African Americans have so many diseases that could be ascribed as deficiency in the immune system, but it's because from the time they're born, all they hear is negative things. So to be able to save us from that, then we have to change the way we do this to the children. Is the only way that we can do that. And so therefore, a study was recently done in where, all of us are accustomed to the fruits and the vegetables, and it gets into our brain on a constant basis. But it has also been shown that most of the African American children, and maybe even Latinos, do not eat at least 2 vegetables and fruits. And if that's the case, the research has shown that there are cognitive deficits in their brain by having that lack. But on the same token, what is it that they have in their communities? They don't have places in where they can get fresh fruits and vegetables. They have convenience stores where there's alcohol and tobacco. And if that's the case, maybe we should get involved into shaping that by bringing something better to the convenience stores by which they can have access to the food that they need. And on top of that, make sure that they know the research that shows at what difficulty you are and what are the consequences of your child not being the most brilliant. But the other thing that really drives me crazy in this business of equity is the prison system that is adjudicated on some of the minorities. And when you look in the areas of the West, it's almost like 3 strikes and you're out. When you have adolescents acting out like adolescents and going to the principal to be able to be blamed for something that in our life is an adolescent behavior. 1 quote goes into and 3 quotes gets you into the prison system. So the behavior, it was judged that it was not the reason for which they need to be punished. It was that the teachers did not understand that was behavior natural in their age group, but it was a way to get them out of the class. That was what they wanted them out. So we have to look into the prison system and why so many people that are minorities are there at this moment, and how many of them basically should have not been assigned to that just because of behavior that was not something that was out of the realm of their youth. So we need to look into that very closely, and especially because, you know, every year thousands of them come out, and every year thousands of them go back because there's no employment and there's no recognition that what you did was not a crime. So we have to start looking into this with not only the reasons, but how can we help? And so remembering that people in the communities of minorities are trusting more and more not-for-profit groups rather than government because of the Tuskegee episode.
Follow-up question to that, Dr. Novello. With all the challenges and that you've been discussing, the theme of racism comes to mind, and
Mhm.
I'm wondering, how do you dismantle these systemic problems when it can be challenging to have discussions about racism and
Well, remember, there was an analysis done by the question, is there a racism in the United States? And I don't remember the exact numbers. It was almost like 44% of the whites says is non-existent. 17% of the Latinos and the Native Americans said, yes, absolutely, it does. So if 44% believe it doesn't exist, and to this day is still the majority of people in the United States, we have to do something to address racism because they don't believe it exists, but it does. And that's why the microaggressions, most people don't even know what a microaggression is. Please tell them, are you in the bus and when somebody that is not your color, you move your purse and yourself a little bit farther? When you are crossing the street and somebody comes right across from you that doesn't look like you, don't you move a little bit more to the left? Those are microaggressions, and you do them every single day. Maybe we have to make that more knowledgeable. And maybe, you know, children have a way of getting to their parents more than us with every message that we get out there. Maybe in those Saturday morning, as we did before, in where the children were asking the grandparents to smoke outside because I love you and I don't want you to smoke. Maybe the time has come for children to call microaggression episodes as things that they see every day, and through their eyes, we might be able to change a little bit of what's happening today, because it seems like the more we talk about it, it seems like there are very little challenges. And even when I look now that 15 states are taking out the Office of Diversity and Inclusion, it seems to me that maybe racism is again winning, and not the issue that we have to learn to address it at the level of academia.
Thank you so much for that answer. We have 5 more minutes for this discussion. Does anyone have any last minute questions in the chat or comments about anything?
Well, I want to ask, have you learned anything? If you have learned anything, then I feel pretty good about having spoken to you from my own perspective, but it might not be the best that you wanted. But absolutely, someday you will be in my position and you will remember some of the things that I have said, because one of the things that I have learned with my life is that I do not sugarcoat it. I lived it. I know exactly how it happened. And I think if I don't know how to fight it, then I will lateralize, because I'm not going to let anybody else hurt me in my career for jealousy. And so I would say, think about going and work for your congressman. Ask, and you will be sure that as the special assistant to the senator, you might never get to even look at him or her, but ask the assistant, the AA of the office, if you're willing and you're a Hopkins person and you really love government and you want to be able to help the senator of the, ego building is always a wonderful way to get in. And the other thing is, know your facts. Don't invent policy out of fear. Don't steal the limelight of your leader. He will always, or she will always appreciate you for knowing when to honor them, because in the long run, you will need the letter of recommendation and their input in your future life. But more than anything, stay attuned of what is the newest technologies coming down the pike, and learn to see how can we influence them better. I'm doing the commencement for Hopkins Medicine on the 22nd, and I really believe that it is an honor that you're taking a public health person to talk in the medicine aspects of Hopkins. I did it already in year 2000, and I think I was the first public health person that did it. But last year, it was the CDC director, and this year is me. And I think that I'm going to make a speech that is going to be common sense. I'm not going to go in highfalutin. I don't need to do that. You will find that in your life. I'm going to tell you about the challenges that you will face, the new technologies that are coming to save your patient's life and your future, and more than anything, lure you into a life of service, because there are great things coming out of that. So it might end up being the most common sense speech given to the class of 2024, but I believe that maybe it might be remembered a little bit more because I spoke to them. I don't spoke through them.
Mhm. Thank you so much for taking your time out of your day to talk to us and to inspire us in the public health journey.
This has been an amazing discussion, Dr. Novello. Yeah, thank you for your time.
Well, tell the ones who did not show up what they missed. But I will absolutely, if needed, and you want me to come again, I will be more than glad to see you back. And more than anything, remember, I will be in Baltimore on the 22nd, lecturing, the honor of lecturing the class of 2024 medicine. And they are going to be in there, the graduate students and the medical students. I think it's about 174 of them.
Yeah, thank you. Thank you.
Thank you.
Thank you guys for having me. I hope that we all learned something. And more than anything, I learned that there's still a lot to be learned. And I'm very, very proud of Hopkins being #1 in the United States. So don't let us go down. #2, never. Thank you so much. You too. You too, guys.
Thank you. Bye. Have a great day.
You too.
Oh.
I need you guys to come out.
Hey, your questions were so good.
Oh, thank you. Yours was too. It was really about the book. It's like.
Thank you. Thank you, Brenda. Yeah,
We got it done.
she was great. She was.
Oh, yeah.